Well, hello, recording. So we have an exciting conversation ahead of us today. First, just want to do some quick housekeeping. This call and any material shared are not to be considered legal advice. I just wanted to flag that for folks, particularly as we talk about civic engagement. You are invited to turn on automated captions. Please see the instructions in that visual on the right. It says like enable auto transcript. This call is being recorded, as you all just saw me do, and will be posted on PIH's YouTube in the next day or two. Please drop your resources links in the chat, and I'll put them in the follow-up email. And you will get that follow-up email if you subscribe to the email list, which we'll put in the chat. That's where we send call invites, follow-up resources. We send very few emails, so I hope you're not signing up for more spam. And we do not have a scheduled Q&A today. Many of you put great questions in the registration form, so we've tried to integrate those into the conversation. But please feel free to drop any questions in the chat and we'll get to them if we have time. I want to take a few moments to just ground us in the moment that we are in before we get into our conversation. So happy June. Particularly, I want to ground in some of the historical importance of this month for our collective fight for justice. My colleagues, Mickey and Elisa, actually did this on a recent call, and I really appreciated this grounding, so I wanted to emulate that. With the ongoing attack on democracy and voter suppression, the rollback of basic rights and fights that we thought we won, we build upon this history of movements, lessons learned, and we remember the real urgency of this moment. And I know many of us have been talking about urgency versus false urgency, but it really feels like we are in an actual moment of urgency. Tomorrow is Juneteenth, also known as Freedom Day, Independence Day, Emancipation Day, which commemorates the official end of legal slavery in the United States. And we hope that everyone here spends tomorrow reflecting on what more we have to do and celebrate the contributions of Black Americans. This month also marks 60 years since Freedom Summer, also known as the Freedom Summer Project or the Mississippi Summer Project, which was a campaign launched in June 1964 to register as many Black voters as possible in Mississippi, which, among other things, built momentum towards the Voting Rights Act of 1965. June is also Pride Month, commemorating the Stonewall Uprising and years of struggle for civil and human rights and the ongoing pursuit of justice and liberation for queer people in intersecting identities of race, ethnicity, ability, sexuality, gender, etc. June is also the 11th annual Immigrant Heritage Month, a time to celebrate the contributions of immigrants to the United States and the diversity of heritages that make up our culture, particularly during the summer that as the election season ensues, we know there are often attacks on immigrant rights, etc., and communities. Last week was the 10th National Gun Violence Awareness Day to raise awareness about gun violence and gun safety measures, which impacts health justice in all of our fights. I'm sure I'm missing a lot. There are often many holidays, like celebration days, memorial days that I missed, so I apologize, and please feel free to share more that I'm missing in the chat. Okay, thank you for letting me do some grounding in the history of what we're building upon. Now, what we are all here for, this month's Health Justice Call, titled Civic Engagement is Central to Movement Building, Protecting and Investing in Our Communities. I would like all of you to take 10 seconds, close your eyes if you're comfortable, and think, reflect. In your work and in your personal life, who are your people? I want to take a few seconds. When we talk about protecting and investing in our communities, these are the people we think about, the people who listen to you, who get an understanding of things from you. Who are those people? And how are you prioritizing conversations about civic engagement with them? You can open your eyes. That's what we're going to be going through today. Speaking of civic engagement, I wanted to flag this is not a partisan call. Civic engagement does not need to be partisan. There are groups here that do partisan work, and most of us here, including our panelists, work at 501c3s and do not do partisan work. We will not be discussing candidates. However, we will be discussing the importance of civic engagement and lessons and tools to support our communities, our people, in their civic engagement and the right to make their voices heard. And we're doing all of this because there's so much at stake this November. We put this in the email, quoting our panelist, Dominique Espinoza, in a recent email, that across the country, there are elections at every level. All members of the US House of Representatives, 1/3 of the Senate, many state and local races, as well as the presidency. These elections will determine whether to invest in intersecting fights for health and justice that we care about. And we all need to work together to make sure that voters, especially those with low incomes and people of color, are able to get to the polls and make their voices heard. And we do this because we believe in those who have the right to vote, to exercise their right to vote, and because we know that the fight for health justice and other justice fights that we intersect with will be impacted by the results of the November elections and could be severely damaged if the people who should vote, the people who are most impacted, don't. You may have noticed that we've been talking about this a lot on the past few health justice calls, and health justice and the intersecting fights for justice that are on the ballot. And we're having this conversation over and over again because we've been noticing, one, it's important, and two, that a lot of other justice groups, particularly in the health justice space, haven't been prioritizing civic engagement and voter engagement, and that concerns us. So we want to really center that on these calls. Prioritizing civic engagement, voting with our people. That's why I asked folks to imagine who are your people. So our panelists are here to talk about how they're navigating these questions with their people, how their organizations are being centers for civic engagement, whether they are specifically civic engagement organizations or not. And I always say this, and I'm so excited we have such incredible panelists joining us today. And I really want to also note that our speakers are not a representative sample of the hundreds of thousands of people fighting in this movement who span a range of identities, knowledge, and lived experiences, nor do we expect these speakers to represent all views. So with that said, we're gonna spotlight our panelists and let's bring them on. Nitesh Felizor from Black Voters Matter Fund Capacity Building Institute, Dominique Espinoza from Coalition on Human Needs, Dimitri Joseph Moyes from Vote ER, Shayna Goodman from National Partnerships for Women and Families, and Camille Kidd from In Our Own Voice, National Black Women's Reproductive Justice Agenda. I have some questions that we've come up with that I've already shared with our panelists, and I've also encouraged them to please just flow off one another, have a chat. We're all here to listen. So everyone sit back, tune in, and let's get started. So Camille and Shayna, it seems like the fights for reproductive justice and reproductive rights feel very salient in this moment, that people who are involved in these fights will turn out to vote because they get what's at stake. As those representing the reproductive justice and reproductive rights movements here today, how are you and your movements continuing the momentum through this election cycle?
So I can jump in with some maybe context setting, and I will pass it to my wonderful colleague Camille to talk more about some of the on the ground work that I know she's doing. So as you said, Allie, that after the Dobbs decision, abortion has been a really significant motivating issue at the ballot box. We saw that in the 2022 midterms and in all the ballot referenda across multiple states where voters have voted to protect abortion access. And we anticipate that abortion will continue to be really salient in the upcoming election. But we also know that there are lots of other issues that are top of mind for people and for campaigns that are running this cycle. And those issues are economic security and healthcare and democracy. And one of the things that we really believe at the National Partnership is that those issues are actually not separate at all, but are really deeply interconnected. And part of our charge in this summer and fall, especially, is to really help policymakers and candidates understand that for real people, these issues are closely related, and voters want to see like the fullness and the totality of their lives reflected in policies and the way that candidates talk about issues. So we're trying to help connect the dots in that way. And what sort of started us to go deeper in this work was really Justice Alito's decision writing for the majority in Dobbs, where one of the things that was especially galling and egregious to us was that Justice Alito said, it's not such a big deal that we're overturning Roe because we're returning the issue of abortion to legislative bodies, and quote, women are not without electoral or political power. And for us, that was like, both enraging and like kind of laughable, because we know that there has been an intentional campaign to undermine our democratic institutions and processes, often by the same people that have been passing restrictive abortion laws and undermining civil and human rights in other ways. And as a result of that attack, the political and electoral power of women and people of color, and women of color especially, has been really intentionally diluted. And so we've recently published 2 papers that kind of look at this intersection and try to amplify kind of the lie at the heart of what Alito was saying. So we published a paper looking at representation of women and women of color in state legislatures, and found that states with the biggest representation gap, so the states with the lowest levels of representation of women and women of color relative to their population, were more likely to be states that have enacted abortion bans or significant restrictions. Like, probably not a surprise to us that those things are correlated, but good to actually like document, right? And then the second paper that we published similarly found that states that have really bad voting laws that restrict and undermine people's ability to vote and make voting really difficult, are also states that are disproportionately likely to have banned or restricted abortion. Again, like, not a surprise, but what that tells us is like, it's not that simple as saying, okay, like, women, you want to protect your reproductive freedom, or people, you want to protect reproductive freedom, go vote. That there's actually structural challenges underlying both of those issues. So I think what feels challenging in this moment with that data and with that information is that we know the barriers to participating in our democracy are really high. And at the same time, we know how essential it is to do that and to help people and voters understand their power and maximize their power, and really feel like it's worth engaging in this process when we've said like, oh, but like kind of the deck is stacked against you, and intentionally so. So maybe that's a good place to kind of segue to Camille, and I'll let you take over from here about the work that you guys are doing on these to connect these issues.
Thank you, Shayna. So I thought it would be good just to kind of start out really quickly, just talking about the tenets of reproductive justice, because I think it contextualizes why, as an organization, and our own voice has always seen civic engagement as linked with the larger reproductive justice movement. So to kind of succinctly put it, the main tenets of reproductive justice are the right to have a child, the right to not have a child, the right to raise a child in a safe environment, and the right to sexual expression and pleasure. And so kind of encompassing all of those things, the way that we view the reproductive justice framework in civic engagement is that all of these issues that people care about all impact their reproductive decisions. And so like as RJ advocates, we don't see the decision to have an abortion as the end all be all. There's a lot more that goes into people's reproductive decision making. And as an RJ organization, it's important to us that we're highlighting all of those things. And so something that we've done consistently during major election cycles is do polling on the state of Black families and how they're feeling about all of these issues. And so something that's been kind of interesting to see being at the organization for the last 4 years and seeing a few cycles is that depending on what's happening, Black communities care about a whole host of issues in a reproductive justice way. They're not just thinking about a single issue. And I think that's where we come in as a Black reproductive justice organization to tie together some of these conversations that we're having. Yes, consistently our respondents say that they're supportive of abortion access. So we
আমি আজকে
that myth.
প্রচন্ড আছি, টায়ার্ড।
Okay, all good. So we debunk that myth, but we also find during all these cycles that people care about different issues. So in this cycle in our poll, we found that the top 5 issues that people cared about were cost of living, racism and racial justice, healthcare, education, and voting rights. And something that you'll hear me say time and time again is that reproductive justice advocates had been talking about this tie-in of the loss of reproductive healthcare access, abortion access, and the decrease in voting rights and the attacks in states. And so for us, those two things have been happening on a parallel path. And then you see the attacks on gender affirming care. You see attacks on what can be taught in schools. And to us, these are all interconnected human rights issues that need to be talked about holistically in order for us to actually talk about solutions. And so as an organization, we launched the I'm a Reproductive Justice Voter initiative as a way to help educate people on reproductive justice, but how that ties into how you think about voting. For us, we want people to think about their impact as, agents of change at all levels of their community. And so we have this wonderful program called the Next Generation Leadership Institute that is designed to build new reproductive justice advocates at HBCU campuses. And so when I'm talking to them about how they engage, civically in their own communities, for them, it may look like raising awareness about period poverty on their campuses to their campus administrators. That's an act of civic engagement. But then that also means that they're teaching students on campus about the initiative. And then we're going out and talking to people about the Reproductive Justice Initiative and trying to tie all of these issues together for folks when they're thinking about what they're going to do moving forward in elections. And I'll start there because I know we have a lot more to talk about, but thank you.
Dimitri, I'm curious from you, all of us here work at organizations that not all do civic engagement. A lot of us are health organizations, health justice organizations. But we think that we all have to be places where people are discussing healthcare and elections. People are discussing housing and elections. People are discussing reproductive justice and elections. Because if we don't prioritize civic engagement and engage folks, then the folks who are most impacted are going to be even further impacted, is what we feel like. So how are you raising the importance of a civic engagement, particularly as a civic engagement org, and particularly voting with the people who listen to you? And why are you doing this? Why does it matter?
So at VoteAR, we are exploring the intersections between healthcare and democracy. We're doing that by utilizing healthcare professionals as the conduit to reach low propensity voters in various healthcare settings. And one of the things that we like to work on, particularly with our healthcare professionals, who are some of the most trusted professionals around, right? It can be very easy to fall into the misinformation or listen to headlines and think that you know the facts. And so one of the things that we like to focus on is letting healthcare professionals know, in our research over the last decade, healthcare professionals have been voting in a range of 13% to 22% lower than the general population. And it can be easily assumed, right, that healthcare professionals are going to the ballot box and making their voices heard, but they're not, for a whole host of reasons. And we normally will see healthcare professionals look very shocked and surprised at those facts. And I think that inspires them to realize, right, I should check my own voter registration. I should see if my colleagues are registered. And then that helps me understand how to talk to my patients about getting registered to vote. And I think now more than ever, peer-to-peer relationship building and relational organizing matters now more than ever before. We're all connected to these little monsters in our pockets that we think we can grab all the facts from. But in reality, it's getting face-to-face with people and really getting them to understand, right? Like, this is the landscape of your community. This is what voting looks like in your state. For example, one of our battleground states is Georgia. And one of the things that our Georgia organizer likes to share with us often is, yes, voter suppression is real, but because of the work done on the ground here in Georgia, people are registered to vote. The problem is getting them to the polls versus a place like Arizona or Nevada, right, where that work to get people registered matters much, much more because folks just aren't registered to vote. So we also like to get folks really understanding the landscape of where they live and understanding, right, that every place is different. Voter suppression is real, but it looks wildly different depending on the state that you're in. And we're often quite surprised when we share these facts with folks because you can see the light bulb go off when they finally hear, like, oh, this is what it's like in Ohio, and here's what I can do about it. And also, I think it can be tough for healthcare professionals, right, to bring up the conversation of voting in a healthcare setting. We like to think of the hospital as the DMV in a way, where you can get registered to vote at the DMV. And similarly, in the intake process, right, a doctor can say, do you drink? Do you smoke? Are you registered to vote? And sometimes that can look very partisan depending on the communities that they serve. But we work on developing conversation starters and really making sure that healthcare professionals understand, here's how you talk about voting in a nonpartisan way. Here's how to get your patients thinking about the things that they're passionate about by helping you understand what you are passionate about as a healthcare professional. What gets you up in the morning and what gets you inspired to heal, to talk to your patients, to make sure that they're supported, and to make sure that they understand, right, that the social determinants of health play a huge factor in all of this. The founder of our organization always likes to say, I can write you a prescription, but I can't change the air quality in your community. I can't, find places for you to have a nutritious meal 3 times a day if you live in a food desert. And so getting people to really understand these links, not just at a federal level, but locally and what's going on in their community, I think is a way that has really helped us inspire the folks that listen to us. I work primarily with our student populations, and so we also like to find ways to incentivize healthcare students. They're very competitive. So a way to do that is, how do you make civic engagement fun for young folks as well? And so we gamify the voter registration process. And thanks to our student program, we've been able to get over 100,000 people registered to vote since 2020. And our organization has reached over 2 million people since 2020. And I think a lot of that comes from the innovative ways that we're helping folks start those conversations and also finding ways to let people know, right? Like, having these conversations, they don't have to be doom and gloom, because that's not going to inspire someone to run to the polls. Sometimes you can make civic engagement a more engaging and fun thing to talk about, and that gets people really wanting to start the conversation.
All of that. Also, and I'm going to ask you all in a little some like what other folks can do and what resources you have for us, but just because I happen to have this on my desk, this is the badge from VoteER. I swear Dimitri didn't pay me to do this, but you can pay me if you want. So you all can get this from VoteER and wear it, and then you can have people scan to register to vote. So I just wanted to just happen to be on my desk. I feel like we're all talking about what we're doing, and maybe it's just because we're all in this so much, but I feel like sometimes it's easy to forget the urgency. And so I just want to talk about, Nitesh, while the rest of us are working, everyone else here on the panel works at national orgs. You're at a national org, but you represent the Florida team for your organization. And we know there's so much going on in Florida and every state, every local area. Like, this election season, we know every election is local to national. And I want to highlight this trend to folks of why local elections are really important, what this means. So I'm going to talk about elected school boards. Elected school boards across the country have been making decisions honoring Confederate leaders, which is a blatant step backwards from the progress made in the fight for racial justice that so many of the movements that I grounded us in at the beginning are built upon. For instance, in Virginia, I don't know if folks saw, the Shenandoah County School Board recently voted 5-1 to restore Stonewall Jackson's name on a high school after their decision in July of 2020 to remove the name. This was a new board that was elected. None of the 6 school board members who voted to restore this name voted to remove it. And so I just want to say, like, these local elections are important from the school board to the president. It really impacts all of us. And so, Nitesh, how are you in your local context pushing for civic engagement, and what are the obstacles you're seeing in the communities that listen to you, and how are you addressing those?
Yeah, thank you so much, Ali. That's a great question. Hi, everyone. So I think that for starters, Black Voters Matter, like you mentioned, it's a national organization. We work in 27 plus states. And we just expanded to the South Florida region. So I'm actually the first person in my role as of February 2024. And so far, I've been in the community. I'm always in these streets. We have at least three to four field days where we're either at like commission meetings, county meetings, we attend town halls, or whether it's like going to a partner event. We have various partners from health justice advocates to environmental justice advocates, Black farmers we work a lot with, to, you know, the amount of networking that we do is a big part of how our organization works and functions. And so we have different issue areas. And BVM is also a capacity building institute. So the way that we work with these partner organizations is those who do GOTV work and issue organizing work, we help uplift and amplify their efforts by providing like trainings, a lot of on the ground with their programming and initiatives. And so when I'm at these things, I get a lot of like in-person on the boots work, and I'm always speaking to whether it's like collaborators, the partners themselves, or local community members. One of the things that I hear the most is that we are not apathetic, right? Or like some iteration of that. There's this like stigma and stereotype that Black people don't vote, or that they're apathetic, they don't care about voting. And that's not true at all, especially when it comes to Black women. As a Black woman myself, Black women care about these issues. Like there are more Black women that are talking about Amendment 4 than there are like their other counterparts, in my experience. And we're not just in Black communities and marginalized communities. We're talking to everybody because we collaborate with everybody, right? Like it's a mutual effort. It's not just like we seek out what specifically Black people are saying, but how can other ethnic groups and races of people help in the efforts that Black people are trying to push forward. And so I think one of the biggest things is education for other groups, right? Because Black women are educated. In these current times, Black women have the highest rates of furthering degrees, of advanced degrees, but yet there's this stigma that Black women are not educated, which interestingly, they have the highest level of advanced degrees, but the lowest rates of like compensation. They're paid the least out of all those. So I think definitely getting other people to understand that we do care and that we are informed about these issues. You know, Black women are 3 times more likely to die during childbirth. That's something that I think a lot of our other counterparts don't understand. So I think reframing the narrative is something that I've understood from being in the community, and something that I'm trying to use my platform at Black Voters Matter to do. And one of the things that we're doing is a Black maternal health campaign. We're launching that on June 29th with one of our partners, Aja Luna, Healing Through Change. And she does a lot of like herbal work, womb healing. And one of the things that affects Black women the most is like fibroids. So Black women are I mean, there's a plethora of things. Black women are 2 times more likely to develop diabetes over the age of 55 in comparison to their white counterparts. They're 2 to 3 times more likely to develop fibroids. I just mentioned they're 3 times more likely to die during childbirth. Although they're less likely to get breast cancer, although Black women are less likely to get breast cancer, if they do develop it, they're 40% more likely to die from it, which is why we see a lot of Black women dying from breast cancer in their late 30s and early 40s, which is like absurd, right? So these are the issues that I think a lot of Black women are pushing forward. It's just that nobody listens to us. And like I say this in my personal life all the time. Black women are educated, Black women know what's going on, and they're vocal. We just now need to get people to listen to us. Like whether it was like Shirley Chisholm, right, or like Sojourner Truth, Black women have historically, even though we've been at the front of power building movements and civic engagement and justice and advocacy, there's been a lot of pushback from other communities who don't want to see us win. And that's why these efforts are not being as amplified as they should be, because there is a lot of pushback. It's not that we don't care or that we're not going out to vote. If anything, in the 2020 presidential election, 2/3 of Black women went out to vote. And that's just one election cycle. So there's been like analyses done that present the facts of Black women being at the forefront of voting. And so we just need to get people to listen to us. We need to elect people who are like-minded in our core values. One of the core values of Black Voters Matter is that one of the 5 core values is that we need to put Black women first. And we do put Black women first. Like this is the first organization that I've been at where I feel like personally as a Black woman in my role, just as a human being, my thoughts, like my concerns, I'm regarded for, like I'm cared for on a more interpersonal level, not just like politically and, you know, like professionally, whatever that is, right? And so I feel like we need to push that forth in like many other organizations and in the streets, right? In like rallies and at the ballot box. We need to push this forward to the people that we're trying to elect to represent us in local elections. And another thing too is local elections, right, as you said, Ali, matter if probably the most, right? Like they matter more than national elections because they affect the people in those communities more directly. So definitely getting those resources out to folks in Miami-Dade, Broward County and Palm Beach counties is something that I've been one of my main goals is to, with this Black maternal health campaign launch, is to talk more about like the intersection between mental health and womb healing, and also like your food health, because also a lot of the reasons that go behind health injustice and health disparities between Black women and their other counterparts are like food insecurity or them living in food deserts, them just not having the access to healthy nutrition, to locally grown organic foods. And so our initiatives with our Black farmers is to get them more resources and more funding in order to provide more access to healthy living, holistic care. And yeah, I'm so sorry I went on a rant, but I'm just super passionate about this, and our people are as well. And I just want them to have the voice that they deserve and that they so do work towards.
No need to apologize. Thank you for everything you shared. And I feel I'm sitting with this tension of and the beauty of like, just like you're saying, like Black women do vote and want to vote. However, there are a lot of people who have the right to vote who say, I don't want to vote this year, who understandably feel discouraged and angry I know, Dominique, you and I have been talking about that. It's how do you encourage our how do we encourage our communities to get to the ballot box, and knowing that they're frustrated, and how do we communicate like what is at stake, and why. And so, Dominique, I'm curious, like, why does this moment feel urgent to you? Who are the communities that you engage with, and how are you pushing for civic engagement with them?
Yeah, Sally, and you're absolutely right. I think the landscape is very different from what it was 4 years ago. And I try to push our Vote for Human Needs campaign in a very honest, empathetic way, because it just feels fake, honestly, to come every 4 years or during the midterms and pretend like you really care about people, especially at the local and state level, and then you don't talk to them the rest of the time. So we really saw an opportunity at the Coalition on Human Needs to work with the people that we work on the whole year. So we are working on investment in human needs. So they are primed on that. They are working on food security. They're working on housing affordability. They are working on access to healthcare. We're working, on the Farm Bill. We're working on the budget. So they are already engaged. And so whenever we talk to them about voter engagement, to them, it's not like, we're presenting a new issue. What we're doing is just connecting the dots. And I think that the way that we frame it is every human needs program is under attack right now. And I come to this with questions like, what is the country that we want to leave for future generations? I ask questions like, are we electing representatives that are that want to fight for affordable housing, for affordable healthcare, that are pro-negotiating on prescription drug medication? So we don't really tell people who to vote for. We are completely nonpartisan, but we try to connect it to the investments in our communities, because if we really think about it, investment in housing, in food nutrition, investment in voting rights, it's all health related, because if a child or any person has food at home, or they have access to internet, they have access to nutritious food and a meal, they have they can thrive in their communities. And I often think about my own family. And I think, I'm an immigrant myself, and my whole family, they've had to work 3 to 4 jobs to put food on the table. So I think of them. I think, how do we talk to those people? They don't have the time. And I think often people in DC at the national level, we assume everyone is up to date with the latest appropriations bill. They know what the Farm Bill is. They care, like they have real issues, like things are expensive, and voting is just not a priority, especially if they see that what they want is not being reflected on their elected leaders. So it's just really hard. So I think that just bringing that home for them and being like, I empathize with you. I hear you. You are right to be angry, but you have to use that anger as your voice. You can't stay silent. You have to take that power, I think, in a way. And I do think that a lot of people, they're constantly saying the youth is not engaged, people of color are not engaged. They are. They are very engaged, but it's like we are not being empathetic towards their needs. So it's more of how we message and how we bring it back to the issues that matter the most to them, and centering ourselves in those values and those investments, and not making it about an election, because that just feels terrible to me personally, but making it about an investment, that a generational investment in our future.
Yes, and I really appreciate the empathy and authenticity. And, you know, we talked earlier, I said earlier, how do we make sure that our organizations, even if we are not civic engagement organizations, embed civic engagement in our work, which also speaks to that authenticity. If we're talking about this always, it's not just like, oh, we're calling you now. Nick actually put a question in the chat that is similar to what I was going to ask, so I'll just read his, which is, what happens if our people vote, and what happens if our people don't? So I'm posing that to all of you. Whoever wants to answer, please.
I can.
Oh,
A bunch of
go
people
ahead,
came up.
Jane.
No. Okay, I'll go really quickly, and then whoever wants to answer can go after too. But I think something that we're continuously talking to our communities about is that if we want to build a reproductive justice future, then we need folks in office who also believe in reproductive justice. I mean, you know, I think that's why we're spending so much time on this peer-to-peer education and trying to educate people on what reproductive justice means and how it shows up in policy, so that when they are making decisions about voting or any other kind of civic engagement, that they're as informed as they can be about what it means for a candidate to also embody reproductive justice values. So that if it's not necessarily about like a person, what are the things that they care about? And does that align with what you care about? Because if we don't engage, it could mean a further rollback of the rights that we have. And like we've seen how quickly that can happen in just the last couple of years. We've got a Supreme Court that can basically decide at any given day that a right that you have lived with for your entire life, for most of your adult life, just doesn't exist anymore. And like how I always try to frame that with folks is, you know, the Supreme Court's unelected, but the people who choose the people who sit at the Supreme Court are not. You get to make a decision about who gets to choose your Supreme Court justices. And so, you know, it's really easy to kind of sit in a lot of the frustration that we all feel. I think that's a collective thing about what we're seeing unfold before us, but we do have the ability to harness the power that we have within our communities to empower ourselves and each other. And that's kind of what we're choosing to focus on with the I'm an RJ voter initiative, just kind of self-education, but then also being able to open up those conversations with the people in your community so that this is a community effort. It's not about the people who work in the big white houses. It's really about how like we're able to engage with each other and create the future that we want.
Yeah. I would even take it a step further, because I do think, of course, if you don't vote, your voice is not heard, and that's pretty obvious. But we actually always invite our list and our advocates to take it a step further and just let them know what you think about every other issue, right? So let's talk about what do you think about prescription drug medication? Like, they should hear what your thoughts. So let's write some letters. Let's get together and be active. I think that looking at civic engagement as a thing that you do every 2 or 4 years, but you're not actually present, you're not actually speaking to your representatives on a regular basis, they won't hear to you. So it's number one, you have to elect people that represent your needs, that look like you, so that you feel represented. And then you actually have to tell them what you care about so they can actually get to work on that issue.
And then piggybacking kind of off of what Dominique just said, definitely agree. Black Voters Matter, one of our like part of our mission statement is that we don't just work on election day or even throughout the election year, but that we work 365 days of the year, every single year. So I think it's also important not just for people to get out and vote and to be and inform themselves about, you know, the different candidates that more so align with their core values and what they want to see for themselves in their communities, but also to incentivize, I guess, more organizations to do this work, not just during election cycles, and be in the community, right? Like as often as possible, because even though there's a lot of people who do care about these issues, a lot of the issues that they face, or you know, the barriers that they face in order to get their voices heard is just access, whether it's access to the ballot box or access to time, right? Like some people work, like my dad, for example, works 12-hour shifts. He still votes, but not everybody's like my dad. Like he's an anomaly, right? And he also has me, who's like super in this work and is able to inform him about a lot of the things. Like I can just brief him about the things that he should know in a nonpartisan way, obviously. But right, like some immigrant families and just people don't have that time, and they don't have the access to other people within their communities to help inform them. So I think the weight probably should be on organizations to just be in the community more, to speak to those who are experiencing and facing these issues at the forefront most directly, to be speaking to them more often, as often as possible.
I
Yeah.
appreciate. Oh,
Sorry, super quick, if it's okay, from
Yeah,
our
please.
perspective, one of our big partners is Healthy Democracy, Healthy People. And health disparities today are so great that your health outcomes are determined by the zip code in which you live. Like that is how great the disparity is. And Healthy Democracy, Healthy People, I'll put.
Dimitri, you just muted yourself, or I don't think I muted you.
So sorry, so sorry. That's my fault. 2024, we love it. Healthy Democracy, Healthy People developed an index, the Health and Democracy Index, that shows states that have higher levels of voting in their communities directly correlate to the health outcomes of those communities. And when states have low propensity voters and see lower outcomes in folks going to the polls, those health outcomes are lower in those states. So really getting people to understand, like, your personal health is going to be affected whether you vote or not vote. Don't let your zip code determine the health outcomes of your people, right? And so I guess for us, we really like to tie in that fact of your personal health is at stake. So think about those issues that matter to you, and think about the gaps that exist in your community, and how can you utilize your power in making that difference in the zip code in which you live.
Yeah, what I really love about what everyone has said so far is that it's coming, at least what I'm hearing, is that it's like coming from this place of building power, right? And that it's not about voting or not voting, but it's about building power in community and playing the long game, right? Like I think so many of us are used to or expect instantaneous results from, what was it, Dimitri, that called it the monster in our pockets, right? Like we can look anything up and we can like expect instantaneous results, and helping people understand that policy is not that. But it's really about building and sustaining power over the long term to get, like as Camille was saying, to get the people who are values aligned in office. And then as Dominique was saying, like to then hold them accountable to the policy priorities, and continue that push over a longer time horizon than I think a lot of us are like would want or are like naturally inclined to operate under. And I know, like for me personally, that's been a shift in my own advocacy, is to think more about what's the 2, 5, 10, 20-year plan for this work, as opposed to like, expecting things to change within 6 months or a year or whatever, and so just thinking about building power in that way, to sustain this work and see that change over the longer term, I think is like, I'm hearing that in what everyone shared. So I just wanted to pull out that thread.
Thank you for pulling that out. I have so many more questions and we don't have much time, but I think you all really highlighted so beautifully that civic engagement is central to movement building and power building for the long run, not just come November. It's the 5-year plan, the 10-year plan, the 20-year plan, because we want to protect and invest in our community's health. And we know that come November 5th and the days after the election, our communities will be impacted for generations based on the results, and then what investments and rule pullbacks are made. And so there's this like both and, it's the long term and the urgency of the next few months. And so we have just 5 minutes left. And so I just really wanted to ask each of you, like, if you have a call to action, if you have a last thing, like, what should everyone here take back home to their movement, to their people? What do you need from us? I'll pop it to Camille first.
I am going to try to be brief. And just kind of say that I think something that's been really important to me in my work at a Black reproductive justice organization in the last couple of years is just like how tied all of our movements actually are. I think we have a tendency to move in silos, and it's becoming increasingly necessary for all of us to be speaking to each other, to be working together and uplifting all of our priorities. I think that's so tied into how we're all movement building. Like, we want everybody to have the best outcome possible. And that means that, like, we all need to be speaking to one another as well. So always here for more cross movement building and just really building up that collective power, you know, for the next couple of months, but like for the foreseeable future. We've got a lot of things that we need to be working on, and it's always best if we're working together.
I'll add on to what Camille said. I see this very often. I feel like people are not talking to each other, organizations are not talking to each other, and we are duplicating efforts instead of just connecting the dots. And that is a really big issue. So something that we try to do is, you know, we are a very small organization with a very small civic engagement arm, which is me. So I can't do everything, but what I can do is I can figure out where all the opportunities are and how they all interconnect. And then, you know, we have an amazing list, and we don't have the bodies or the capacity to put on voter registration drives or set up voter ID clinics, but I do work with folks that do that. So what I do and what CHN does is we try to recruit as many volunteers as we can through our email program, and we just funnel them to everyone else who needs bodies. Because people are desperate to find, you know, people that have time in their hands to do everything from a phone bank to a text bank to a letter writing event. So I think just keeping the communication open, and also just knowing, you know, what kind of service each organization does, what kind of presentation we each do. Like, for example, myself, I can train service providers to do GOTV from scratch. So like, if they want to get started, their do's and don'ts. And if we're not having conversations, you wouldn't know I do that. So then when you're having conversations, you wouldn't think of me. But having a space like this makes it so that you all know what we're doing. And I'll put in the chat the call to action. So if you want to volunteer or share it out, something we do is we do a drop-down menu of options that you can take on how you want to volunteer, and then we match you up to that opportunity. So also, if you have other opportunities for volunteering, let me know, and I will include them moving forward.
One of the things that I try to do in my role, as far as calls to action, is whatever event or meeting, town hall, training, wherever I'm at, and I can physically interact with people face to face, is try to hone in not just on why it's important to register to vote and vote, or when, like dates and deadlines, like all that stuff, I think is a lot more accessible and that people are talking about more. But one of the gaps is who, like, what roles, what positions are candidates running for? Are there in general? Like, a lot of, I think, younger people too, especially, don't even know like what the difference in roles are between, for example, like a council member and a mayor, versus that of a governor and a state representative, versus a congressional candidate. So it's like, you know, making more awareness and pushing forward more information about those specific positions that we are voting for, not just that it is important to vote for these people. Because I think then there's more attention to what capacity these people that we're voting for have the opportunity to do. And then that connects perfectly to the issues that matter most to them. I'm voting for a commissioner, or I'm even more incentivized to do more research on these commissioner seats. Because for one, I know what the commissioner is, I know what the position is and consists of. And then I think everything else kind of follows through.
Yeah, and to bring it back to the misinformation piece, I think a call to action for me would be, how can you become a trusted resource for your community? It's so easy to find all the wrong information, right? And I do believe that education and knowledge is power. And so how can you be that person that can find those resources for folks that point people to the truth of what's going on and what is happening in their community? I've become a resource for folks in my own community. I do a lot of work in the HIV space too, helping to break stigma and working to end the epidemic. And to share a quick story, one of my really good friends, who's a heterosexual girl, she talked about how at dinner, one of her sisters brought up some wrong fact about HIV. And because of our friendship, she was able at that dinner to be like, actually, these are the facts and this is what I know, right? And so how can you do the same and become that trusted resource for your friends and family?
Shayna, final word?
Oh, I was just going to say, I don't know that I have much to add. I was going to end on Dimitri's excellent note about, like, I think someone said in the chat, it's all relational, right? And just, I think we're all professionals, and to follow what Camille said, like, we should take seriously our professional obligations to be in relationship to each other so that we're resisting the siloing of our issues. But we're also all people that live in communities and that have personal relationships with people across a range of perspectives and priorities, and to take that relational organizing piece to heart in all aspects of our lives, and be that voice that can, stay in relationship and stay in conversation with people and continue to connect the dots and facilitate that kind of understanding about how all of these issues are interconnected, and how they're all connected to the strength of our democracy and to our participation in our civic institutions.
Yes. If everyone could come off mute, I know folks are heading out, and just give a round of applause for our panelists. Please, please, please. Thank you all. I'll be off mute for you all. Thank you so, so, so much. You all said what I was about to say, which is, this is a great time for everyone to make new friends and be in relation with new people, to make new friends, new allies. So I hope everyone here gets in touch with our speakers and the amazing resources they have, which will all be shared out in follow-up emails. So for those who are phoning in, everything, all the links we will share out. We know everyone here has so much more to say, and we will have time on future calls to hear more. So sign up for the listserv to get invites to the August call. And just to everyone tuning in, I really hope you feel inspired by these incredible health justice leaders and have new insights and tools to center intersecting fights. There's a lot for us to do. There is urgency, long-term, short-term. We know that where things stand the day after the November 5th elections will have a lot to do with the future of our movements and the lives and the livelihoods of the people that we care about. So come back in August. We'll see you then. And when you sign off, if you could fill out the 1-minute survey, that would be very helpful so we could meet your future call needs. Thank you, everyone. Thank you, Dimitri, Shayna, Natasha, Dominique, Camille. Thank you, thank you. And we'll see you in August. Bye, y'all.